The badge hit the floor at 6:47 in the morning, and the crack of plastic against linoleum was loud enough that 3 nurses at the station looked up. It skidded under the medication cart and stopped against the wheel, face up, the photograph staring at the ceiling. Nurse Mara Ellison stood in the middle of the corridor with her hands at her sides and her jaw locked, and Dr. Seth Calloway was already walking away, white coat swinging, not even looking back. 12 years of her life. 2 combat deployments nobody in this building knew about. And he had just called her some, in front of everyone, a liability with a stethoscope. He had no idea what he had just done. Before we go any further, if you're watching this from your city, drop it in the comments right now. I want to see how far this story travels. And if you want to know what happens to Seth Calloway by the time this is over, hit like and follow along. Because what's coming will change everything you think you know about who the quiet ones really are. Mara Ellison had been at Denton General Hospital in Forsyth, Montana for 3 years, and in that time she had never once been late to a shift, never once falsified a chart, and never once lost a patient she had authority over. She was not the kind of nurse who lingered at the station gossiping or who brought homemade cookies to earn goodwill from the attendings. She showed up, she worked, and she went home. The other nurses respected her in the way you respect someone who carries something heavy and never mentions it. The residents found her slightly unnerving. She had a way of reading a deteriorating patient 2 minutes before the monitors agreed, and she rarely explained how she knew. The morning it all collapsed started the same way every shift started, which was with the overnight handoff running long because Thomas Reyes, the charge nurse coming off nights, couldn't find the updated orders for the patient in Bay 7. "It's in the system," Mara said, pulling up the chart on the terminal at the nurses' station. Calloway updated it at 4:12. Tomas leaned over her shoulder. "That's the one I'm not sure about. He changed the heparin drip to 1.2 units per kilo. Patient's on dialysis, Mara. She came in at a GFR of 11. Mara stared at the screen. She did the math without reaching for a calculator, and the number she arrived at sat in her chest like a cold stone. A patient with that level of kidney function on a heparin drip at that rate was being walked toward a bleed. "Did anyone flag it?" she asked. "I flagged it to the overnight resident. He said Calloway signed off." "The resident or Calloway?" Tomas didn't answer, which was itself an answer. Mara pulled on her badge lanyard and walked toward Bay 7. The patient was a 61-year-old woman named Dorothy Marsh, who had been admitted 3 days earlier for a pulmonary embolism. She was small and soft-spoken and had a photograph of her grandchildren taped to the bed rail with medical tape. She was also, at that moment, on a heparin drip that was going to send her platelet function into the floor if no one corrected it within the next several hours. Mara checked the infusion pump, checked the last lab values, checked the timestamp on the physician order. Then she turned off the drip and paged Dr. Calloway. She did not page him gently. She paged him at the urgent priority, which in Denton General's system meant your phone vibrated 3 times in succession and showed a red flag on the screen. Most attendings hated that page. Calloway hated it in a way that was somewhat legendary among the nursing staff. He appeared 6 minutes later in the doorway of Bay 7, and he was already talking before he fully entered the room. "Who paged me urgent at 7 in the morning for a stable PE patient?" "I did," Mara said. "The heparin rate is wrong for her renal function. I stopped the drip pending your review." The shift had just changed. The day staff was filtering in. 3 nurses were at the station within line of sight of Bay 7's open door. 2 residents were writing notes at the terminal. Everyone was, in the way of hospital mornings, pretending not to listen while listening to everything. Calloway looked at her with the particular expression of someone who has never in his professional life had a nurse turn off one of his orders without his instruction. It was not anger exactly. It was something more refined than anger, something that had been cultivated over years of unchallenged authority in a department he effectively ran because the chief of medicine was 63 and largely checked out. "You stopped my drip," he said. "Yes." "Without calling me first." "I paged you. That is calling you." He stepped into the room and lowered his voice, though not enough. "Ms. Ellison, I'm going to explain this once. My orders are my orders. You don't adjust them. You don't stop them. You don't second-guess them based on your nursing school pharmacology. If you have a concern, you document it and you wait for a physician to review it. Her GFR is 11, Mara said. The rate you ordered carries significant bleeding risk at that level. I documented the concern, and I also stopped the drip because waiting for review while it runs is not a reasonable option in this case. He stared at her. She watched him decide in real time what kind of scene he was going to make. He decided to make the kind that left a mark. He walked back out into the corridor. He stood in the open space between Bay 7 and the nurse's station, and he turned to face her and he said, loud enough that there was no ambiguity about who was meant to hear it, "Let me be clear about something for the entire team. This nurse stopped a physician-ordered medication without authorization. She then questioned the clinical judgment of a board-certified trauma attending with 17 years of experience. That is not advocacy. That is a liability." The corridor went quiet the way corridors do when something bad is happening in plain sight. If anyone on my team, and the way he said my team made it clear that he did not consider Mara part of it, believes that nursing staff are empowered to override physician orders based on their personal interpretation of lab values, I want that corrected right now. We have a chain of command for a reason. He looked at Mara directly. You're going to put that drip back on its original rate? Document that you stopped it in error, and then you and I are going to have a conversation with HR about what appropriate professional boundaries look like. Do you understand me? Mara looked at him for a long moment. She was aware of everyone watching. She was aware of Dorothy Marsh in the bed behind her, who had gone very still. I understand you, she said. Good. I'm not restarting the drip. The silence after that was the kind that has weight. Calloway's expression moved through something she couldn't fully name. Disbelief, calculation, then a flat and deliberate coldness. Then you're done here, he said. Get your things. What? She got her things. She did not cry in the locker room. She changed out of her scrubs because she didn't feel right leaving in hospital property, even though technically she'd earned the right to keep 100 pairs of those scrubs for what they'd paid her in 3 years. She folded them on the bench and put her street clothes on and sat there for a moment with her hands on her knees, not thinking about Calloway, thinking about Dorothy Marsh. She pulled out her phone and sent a message to Tomas. Check on 7 before anyone restarts that drip. Get pharmacy to review. Tomas responded in under a minute. Already did. Pharmacist flagged it. Attending is on his way. She stared at that message for a while. Then she picked up her bag and walked out. The badge was still on the locker room floor. She hadn't noticed it come off when she changed, but there it was, face up, her photograph looking at the ceiling. She picked it up. She stood there holding it for a second, this small laminated square with her name and her title and her hospital photo where she was squinting slightly because the light had been in her eyes. She set it on the bench. She didn't take it with her. The walk through the ER toward the exit was the longest she'd taken in 3 years. She passed Bay 3, where a man was recovering from a coronary cath. She passed Bay 9, where a teenager was getting his laceration sutured. She passed the trauma bay, which was empty and clean and smelled of antiseptic and the particular metallic cold of a room that was ready for something bad to arrive. She pushed through the exit doors, and the Montana morning hit her, cold and pale, the sky the color of old aluminum, the parking lot still dark at the edges where the lights didn't reach. She had parked in the far lot because she always parked in the far lot to leave the closer spaces for patients. She had done this without thinking about it, every shift, for 3 years, and the habit of it sat in her chest now like something quietly devastating. She was almost to her car when the ground shook. Not metaphorically. The asphalt under her feet vibrated, and then the sound arrived, a low concussive pressure that she felt in her back teeth before she heard it properly. She stopped walking. She turned east toward the industrial quarter of Forsyth, and she saw it. A column of black smoke rising in that particular billowing way that meant something had ruptured and was still burning. Orange light pulsed at the base of it, visible even in the gray dawn. She had seen columns like that before. Not in Forsyth, Montana. In places with different names, different climates, different languages spoken in the dust. Her phone was already buzzing. She looked at the screen. A text from Tomas, turning on scanner. Something blew up near the Caldwell refinery. They're saying multiple casualties. She stood in the parking lot and looked at the smoke and felt something shift inside her. Not panic, not adrenaline exactly, but a kind of clarifying quiet. The kind that came when the noise stopped mattering and only the task was left. She turned around and walked back toward the hospital. Loshat, the ER transformed in under 20 minutes. That was the thing about mass casualty events that the public never understood. It wasn't the arrival of the casualties that broke the system first. It was the 20 minutes before they got there, when the radio was going and the charge nurse was trying to activate the MCI protocol, and staff members were calling back in from their parking lots, and the overhead PA was doing its flat bureaucratic chime. Code orange, all available personnel, code orange. And everyone was trying to move at once through hallways that weren't designed for this. Mara came back through the ER entrance at a walk, not a run, which is how she'd been trained to move in a hot zone. Running spreads panic. Walking with purpose moves faster than it looks. Tomas saw her first. Mara, what do we have? First units are saying at least 30, maybe more. Burn injuries, crush injuries, blast lung. They're pulling people out of the refinery, but part of the complex is still on fire, so there's going to be more. Where's Calloway? Tomas's expression did something complicated. He was here. He took a call, went to his office. Nobody's seen him since the code orange went out. She looked around the ER. She saw Dr. Priya Nambiar, the first-year resident who'd been at the terminal an hour ago, standing near the trauma bay with a clipboard, and the particular frozen quality of someone who had run the MCY simulation exactly twice in residency and was now watching the real version arrive. She saw the charge nurse, a woman named Bev Lorca, on 2 phones at once, voice elevated, trying to reach the on-call surgical attending who wasn't picking up. She saw the ER tech, Marcus, who was a 24-year-old former EMT and the most practically capable person in the room, already moving equipment toward the trauma bay without being asked. She saw a hospital that was about to be hit by something it wasn't ready for, and a team that needed someone to make a decision. She walked to the supply cabinet and started pulling. Mara, Bev called. You can't be back here, Calloway. Calloway's not here, Mara said. Who's the senior physician on the floor right now? Bev blinked. Dr. Nambiar, technically, but she's a first Dr. Nambiar. Mara spoke at a volume that carried without shouting. I need a verbal order to prep 4 trauma bays for MCI burns and blast. Say yes or no. Priya Nambiar looked at her. She was 27 years old and had done 3 months of emergency medicine. She was smart enough to know exactly how far out of her depth she was, and smart enough to recognize that Mara was not. Yes, she said. Do it. The first ambulance arrived 8 minutes later. The patient was a refinery worker named Dale Ostrowski, 44 years old, 2nd and 3rd degree burns covering his forearms, neck, and the left side of his face. He was conscious and trying to talk, which was both a good sign and a complication because it meant he was fighting the oxygen mask and pulling his blood pressure up with the effort. Mara took the hand off from the paramedics and started moving. Dale, look at me. I need you to breathe through the mask, not around it. My guys, he said. His voice was wrecked. My guys are still in there. The fire department is pulling them out right now. Your job is to stay with me. She checked the IV the paramedics had placed. Antecubital right arm, decent, but the line looked positional. What's his pressure en route? 92/60 on scene, 88 in the rig. Trending down. She looked at the burn pattern. Deep partial on the forearms, full thickness at the wrist where his glove had apparently burned through. The facial burn was serious, but surface area wasn't catastrophic. The more immediate threat was the fluid shift coming, and it was coming fast. Marcus, I need a second large bore in the left AC, wide open LR, and I need a Foley. Priya, can you get in here? Priya appeared at her elbow, already gloved. What do you need? I need you to listen to his lungs and tell me what you hear. Priya put the stethoscope on Dale's chest. She listened. She looked up at Mara with something that was not quite alarm but adjacent to it. Diminished on the left, she said quietly. Is there a crepitus on palpation of the chest wall? Priya pressed gently. Dale winced. She pressed again. Maybe. Yes. He's got blast lung on top of the burns. We need a chest film, and we need to be ready to tube him if his SATs don't hold. Mara looked at the monitor. SAT was 91 on high-flow O2. Start him on a fluid resuscitation protocol. Parkland formula, Do the math based on the surface area estimate. I'd say 18 to 20% TBSA. Yes. Okay. Priya started calculating on her clipboard. The second ambulance arrived before the first was fully settled, then the third. By the time they were managing the sixth patient, the ER had its own weather. That was the only way Mara knew to think about it later. A mass casualty event had a climate, a pressure system, and you either moved with it or you got flattened. The corridor outside the trauma bays had become a triage space. The waiting room had been cleared and converted to overflow. 3 nurses who'd been pulled from the medical floor were somewhere in the building looking for the supply cart that had been mislabeled and sent to the wrong wing. Mara moved from bay to bay and did not stop to wonder whether she was authorized to do this. A 22-year-old with a crush injury to his right leg, compartment syndrome building, pulses diminishing. She talked Priya through a bedside assessment, flagged the need for an emergency fasciotomy, called the on-call orthopedic surgeon herself because Bev was still on the phone with administration arguing about resource allocation. A 50-year-old woman pulled from a collapsed outbuilding, GCS 12, pupils unequal. Mara stood over her and felt the familiar, terrible arithmetic of a traumatic brain injury presenting in a hospital with no neurosurgeon on site. A construction contractor with shrapnel in his shoulder and what looked like a tension pneumothorax building on the right side. She directed Marcus to prep a needle decompression kit and talked him through the placement because Priya was tied up with the leg injury and the only other physician in the ER was a 60-year-old hospitalist named Dr. Finch, who had not done emergency procedures in a decade and was currently doing the thing that some physicians do in real crises, which is find a phone and talk into it very seriously while other people do the work. Mara did the work. At some point, she couldn't have said exactly when, she stopped thinking in terms of what she was licensed to do and started thinking only in terms of what the patient in front of her needed and whether she was capable of providing it. These were not the same calculations she had been taught to run in nursing school, and they were exactly the calculations she had been running for 2 years in environments considerably more chaotic than a Montana emergency room. Between the 9th and 10th patients, she stopped at the sink and ran cold water over her wrists for 15 seconds. An old trick. The cold shocked the stress response back into something manageable. Tomas appeared beside her. "You okay?" "Fine. What's the count?" 14 in-house, 3 more en route, 6 held at scene pending stabilization. "Where's Calloway?" Thomas looked at her with the expression of someone deciding how much to say. "His car is gone from the physician's lot." She turned off the water, dried her hands. "Okay. Mara, I need you to find out if there's an OR available and who's scrubbed in. The leg in Bay 2 is going to need a fasciotomy in the next hour, or we're losing that limb." She went back to work. "Thoughts." The 15th patient was the one that stopped her. He came in on a stretcher at 9:42 in the morning, brought in by 2 firefighters who'd pulled him from the secondary explosion site. He was 16 years old. His name, according to the firefighter holding his hand, was Kieran. He'd been on a school work experience placement at the refinery offices, which had not been near the primary explosion but had been close enough to the secondary when the storage tank went. He was unconscious. GCS of 6. His right pupil was blown. The CT scanner was occupied, but Mara didn't need a scan to read what was happening. She'd seen a blown pupil and declining consciousness before. She'd seen it in people who were minutes from the kind of damage that doesn't reverse. She stood at the head of his stretcher and looked at the monitors and felt the specific weight of a situation that had only one path through it, and that path was one she had never taken in a hospital. "Is there a neurosurgeon anywhere in this building?" she asked. Her voice was steady. Bev was already shaking her head. "Dr. Hartwell is in Billings at a conference. The on-call coverage is Dr. Yuen, but she's in surgery in Billings too. I've been trying to reach the trauma transfer line to get a helicopter from university, but the weather..." "What's the weather?" "Wind shear advisory. They grounded everything out of university until noon at earliest." Mara looked at Kieran. His pressure was dropping in the pattern of herniation. Blood pressure climbing, heart rate slowing, the Cushing reflex presenting like a textbook illustration. Except this wasn't a textbook. This was a 16-year-old with his whole face slack and his right pupil fixed and the clock running out in a way she could actually feel. She pulled out her phone. There was a number she hadn't called in 2 years. She had kept it in her contacts the way you keep a fire extinguisher. Present, essential, never touched. She called it. It rang 4 times. She was already calculating time to irreversible when the line connected. Ellison. The voice on the other end was male, unhurried, and carried the particular quality of someone who had been woken in the middle of the night 100 times and learned not to add urgency before they understood what they were dealing with. It's Mara. I have a 16-year-old with a transtentorial herniation in progress. No neurosurgeon, no transfer option, no CT. I'm looking at a blown pupil and Cushing's. I need to talk through an emergency temporal decompression. A pause. 3 seconds, maybe 4. Where are you? Denton General, Forsyth, Montana. Mass casualty event. I'm the most qualified person in the room, and that is a genuinely terrifying sentence. Another pause. Then, flat and certain. Okay, tell me your setup. She told him. He started talking. She worked for 22 minutes. She didn't think about the fact that she was doing something she had technically never done in a civilian context. She thought about what the voice in her ear was saying, and she thought about the anatomy she'd learned in conditions far less controlled than this. And she thought about Kieran, whose hand one of the firefighters was still holding, even though there wasn't room for him in the bay, and he'd been asked twice to step back. At minute 19, Kieran's left hand moved. At minute 22, his pressure stabilized. At minute 24, Bev appeared in the doorway and said, in a voice that had lost its professional composure entirely, "His pupils are equal." Mara set down the instrument she was holding. She became aware of how much her shoulders hurt. She hadn't noticed that while she was working. "Get me a post-procedure neurocheck in 10 minutes, she said. "And someone needs to call his parents." She stepped back from the table and looked at Kieran's face, slack, sedated, but breathing, pupils equal and reactive, and felt something settle in her chest that was neither pride nor relief, but some combination of the two that didn't have a clean name. She pulled off her gloves and walked into the corridor. The hallway was quieter now. The first wave had been absorbed. The nurses moving through the space were moving with the efficient tiredness of people who had been running hard and were starting to find their rhythm. Priya Nambiar was writing notes at the station, and she looked up when Mara came out, and her expression was something that Mara didn't know how to receive. She was almost to the break room when she heard the doors. Not the ambulance bay, the main entrance. She heard them in a way that made her turn, some instinct she couldn't have articulated, some quality to the sound of them opening. 3 black SUVs were visible through the glass, parked in formation along the emergency entrance drive. Not police, not FBI. Something else. Something in the stillness of the vehicles, the precision of how they'd parked, that spoke a language she recognized from a different part of her life. Men and women in dark clothing were getting out. She counted 6. They moved toward the hospital entrance with the particular economy of people who did not waste motion. The lead figure, a woman in her 50s, close-cropped gray hair, posture that said a great deal, scanned the lobby through the glass and then looked directly at Mara. Mara stood in the corridor and felt something she hadn't felt in 3 years, the specific recognition of being found by people who had been looking. Her phone buzzed in her pocket. The text was from a number that didn't have a name attached. It said, "We heard what happened. We're here. Don't go anywhere." She read it twice. Through the glass, the woman with the gray hair held her gaze and gave a single, deliberate nod. The woman with the gray hair didn't wait for the lobby doors to fully open before she was already reading the room, not Mara's face, not the chaos behind her, but the whole space at once. The way you scan a room when you've spent years in rooms where what you miss can kill someone. Her name, Mara would learn in the next 60 seconds, was Colonel Diane Ostroff. Retired. The word retired doing almost no work given how she moved, how the 5 people behind her moved, how all of them held the particular stillness of people who had turned their nervous systems down to a low idle a long time ago and never quite turned them back up. Ostroff stopped 3 feet from Mara. She looked at the dried blood on Mara's forearm that Mara hadn't noticed yet. She looked at the controlled wreckage of the ER behind her. She looked at Mara's face. "You did the temporal decompression," she said. It wasn't a question. Yes. The boy is stable? As of 8 minutes ago. Ostrov nodded once, the way people nod when something confirms what they already knew. We've been monitoring the emergency frequencies since the explosion. When the MCI code went out and the hospital's physician roster showed no trauma attending on site, we drove from Billings. She said it the way someone reports a route. No drama in it. That's 3 hours, Mara said. 2:40 with the lights. Behind Ostrov, the others were already moving. Not waiting, not asking, just orienting themselves toward the work. One of them, a younger man with a field medic's build and the habit of cataloging exits, caught Tomas by the arm near the station and started asking questions in a low, focused voice. Another went directly to the trauma bay board and started reading the patient list. Mara watched this and felt something strange and specific. The sensation of being in a room where other people spoke her first language, the language she'd had to suppress for 3 years to function in a place that didn't know it existed. "Who are you, officially?" she said. "Officially, we're a contracted medical support team doing a welfare check." Ostrov almost smiled. "Unofficially, 3 of the people behind me have more combined surgical hours in austere environments than this hospital's entire attending roster, and we heard you were working alone." Mara looked at her. "I wasn't working alone. I had a first-year resident." "I know." This time Ostrov did smile, briefly, like a door opening and closing. "That makes it worse." What happened in the next 2 hours was not heroic in the way the word gets used. It was not clean. It was not a sequence of triumphant moments strung together with swelling music. It was instead the specific grind of too many patients, not enough hands, and a building that had not been designed to absorb what the Caldwell refinery had sent its way. Ostrov's team integrated into the ER without ceremony. They didn't announce themselves to the staff in any formal way. They simply appeared at bedsides, at procedure tables, beside nurses who were running out of options. And they worked. The younger man with the field medic build, who introduced himself only as Garrett, spent 40 minutes in Bay 2 helping the orthopedic surgeon who'd finally arrived manage the fasciotomy on the leg injury that Mara had flagged an hour earlier. He didn't perform the procedure. He handed instruments, monitored vitals, and at one point quietly told the surgeon that the patient's pressure was trending in a direction that required attention, which the surgeon incorporated without comment, which told Mara everything she needed to know about how Garrett had framed it. Ostrov herself set up in the overflow area and worked triage. She moved through the waiting room turned patient area with a clipboard and a calm that was not indifference. It was the other thing, the harder thing, where you care enough about the outcome that you don't let the emotion interfere with the assessment. She reclassified 2 patients who'd been under-triaged in the initial crush and got them into bays before they could deteriorate further. She identified 1 patient who was stable enough to be transferred out to free up space, arranged the transfer in 1 phone call, and moved on. Mara watched this between her own patients and felt, for the first time all morning, like the hospital might actually hold. She was checking a burn patient's fluid balance when Priya appeared at her shoulder, and Priya's face had the particular expression of a resident who has seen something she doesn't have a framework for. "Who are those people?" Priya asked, low. "Help," Mara said. "That woman, the one in the dark jacket, she just intubated the patient in Bay 6 in under 2 minutes. I've seen attendings take longer." "She's had practice." Priya stared at her. "Mara, who are you?" It wasn't an accusation. It was the genuine question of someone who had spent the last 3 hours watching a nurse run a mass casualty response with a precision that had no explanation in her personnel file, and who had just watched a team of strangers arrive and orient themselves around that nurse like planets around a sun. Mara didn't answer immediately. She finished the fluid balance calculation. She wrote the number on the chart. "Someone who showed up," she said finally. "Same as you." Priya looked like she wanted to push further, but another patient's alarm went off and the moment dissolved. Dumb. At 11:15, they found out where Seth Calloway had gone. It was Bev who brought it to Mara, and Bev's face was doing the thing it did when she was angry and trying to stay professional about it, which meant her jaw was set, and she was choosing her words with visible effort. "Security pulled the badge logs," Bev said. "He badged out at 7:52. 11 minutes after the code orange went out. Mara absorbed this. Did he call anyone? The chief? He called Dr. Finch and told him he had a family emergency. Bev stopped. There's no family emergency. His ex-wife, I know her, we go to the same gym. She texted me an hour ago asking if the hospital was okay because she'd seen the news. She hadn't heard from him. The number of things Mara could have said in that moment was significant. She said none of them. Document the badge log, she said. Timestamp. Everything. Don't delete anything. Don't let anyone else access that system without admin authorization. Do it now, before anything gets buried. Bev looked at her steadily. You think someone's going to try to bury it? I think he has family connections on the board, and I think this is the kind of morning that gets rewritten later by whoever writes the incident reports first. So write yours now. Bev left. She moved with purpose. The second wave of patients from the Caldwell site arrived at 11:40, which was when the fire department finally got the secondary structure stable enough to extract the people who'd been sheltering in place in the eastern end of the complex. 6 patients, 3 of them serious. The serious ones were a woman with bilateral leg fractures from a collapse, a man with severe inhalation injury whose airway was closing faster than his oxygen numbers told the full story, and a 14-year-old boy who had been on a sibling visit to his father's workplace and was now presenting with blast-related ear trauma, a broken collarbone, and the glazed 1,000-yard expression of a kid whose nervous system had absorbed more than it knew how to process. The man with the inhalation injury was the immediate problem. His name was Terrence Adler, 51, and he'd been in the eastern end of the refinery complex when the secondary went, and he'd been breathing the smoke for close to 3 hours by the time the firefighters got to him. His airway was swelling from the inside in the way that thermal inhalation injuries do, slowly at first, then suddenly, a window that opens and closes and doesn't reopen. Garrett was already at Terrence's side when Mara arrived. He'd had the same read on the airway timing. He needs to be intubated now, Garrett said. Before, actually. I know. She looked at Priya, who was beside her. Dr. Nambiar, this is a rapid sequence intubation. I'll walk you through it. Priya's jaw was tight, but her hands were already moving toward the laryngoscope. I've done 3 in the sim lab. This is going to be harder because the airway's hot. You're going to have edema obscuring your view. Go in with the video blade, and if the cords are obscured more than 30%, tell me, and we'll go surgical. Surgical meaning, crick kit is on the left side of the cart. You won't need it. Priya intubated Terrence Adler in 4 minutes. The cords were partly obscured. She said so, clearly, without panic. And Mara talked her through the angle adjustment, and the tube went where it needed to go, and Terrence Adler's oxygen saturation came up from 84% to 97% in the 2 minutes that followed. Priya stood with the laryngoscope in her hand, and she was shaking slightly. Not badly, just the fine tremor of sustained adrenaline. And she looked at Mara with an expression that Mara recognized as the specific look of a person who has just found out what they're capable of. Good, Mara said. Document everything. Every step, every time. Why do you keep saying that about documenting? Because what's on paper is what happened. Whatever else gets said later, what's on paper is what happened. At 12:30, an administrator named Paul Wentz appeared in the ER. He was not a medical person. He was the kind of hospital administrator who existed in the space between the board and the clinical floors, the person whose job was to manage the institution's exposure in situations where exposure was possible. He was wearing a suit on a Saturday, which told Mara everything about what kind of call he'd gotten and from whom. He found Mara at the nurse's station, and he had the careful affect of someone who was about to say something that had been pre-screened by legal. Ms. Ellison, he said, I understand you've been providing care today during the emergency. Yes. We appreciate the effort. In extraordinary circumstances, people step up. A pause that had architecture to it. But I want to be clear that any procedures performed outside the scope of a registered nurse's license are going to need to be reviewed. For the patient's sake, as much as anything. For the patient's sake, she repeated. The hospital has to consider its liability. 14 patients are alive right now who were not going to be alive at 9 o'clock this morning, she said. The physician who held trauma attending responsibilities for the shift left the building during an active mass casualty event. If the hospital's primary concern is liability, I'd suggest the order of review be reconsidered. Wentz looked at her with the expression of someone recalculating. Dr. Calloway had a family. There's no family emergency. The badge log shows he left 11 minutes after the code orange. Bev Lorca has already documented it. I'd recommend you read her report before you finish that sentence. He went quiet for a moment. He looked past her at the ER, which was still active but no longer in free fall, and at the unfamiliar faces moving through it with quiet authority, and something shifted in his expression that wasn't resolution, but was the first recognition that the ground wasn't where he thought it was. "Who are those people?" he asked. "Help," she said for the second time that day. He left without saying what he'd come to say. Chit. Ostroff found Mara in the break room at 1 o'clock. Mara was sitting at the table with a cup of coffee that had gone cold and a granola bar she'd opened and not eaten, and she was running through the patient list in her head the way she used to do after operations, accounting for every person, every outcome, every decision point where something could have gone differently. Ostroff sat across from her without asking. She had a tablet in her hand. 17 stable, she said. 2 still critical, but on the right side of the line. Kieran is responding to voice. The fasciotomy patient is out of the OR. She set the tablet on the table. You know what the survival rate for a mass casualty event of this complexity without adequate trauma coverage looks like. Mara didn't answer. Worse than this, Ostroff said. Mara picked up the cold coffee and put it down again. Why are you really here, Colonel? It was the first time she'd used the rank, and Ostroff registered it without showing much. We've been aware of you for a while. We knew where you landed when you left service. We respected the decision. Ostroff turned the tablet to face Mara. On the screen was a document, official letterhead, dense text, a seal in the corner. When the emergency went out and we saw your name on the hospital roster, you thought you'd come see if I needed rescuing. I thought I'd come see if you needed backup. A beat. You didn't. Mara looked at the document on the tablet. She could read enough of it from where she sat to understand what it was. A commendation, dated nearly 4 years ago, classified. Her name at the top. A list of actions in a place and time that were still officially redacted. That's going to be made public, Ostroff said. Not today. But what happened here today is going to get attention. And when it does, your record, your full record, is going to be part of the story. We want that to happen correctly, not through leaks or rumor. And what does correctly look like? It looks like the institution formally acknowledging the service you performed, in writing, on the record, with the specificity it deserves. Ostroff looked at her steadily. And it means the people who treated you like you were nothing this morning have to do that while everyone is watching. The break room was quiet except for the refrigerator hum and the distant reduced noise of an ER finding its footing again. Mara stared at the tablet. She thought about the badge she'd left on the locker room bench. She thought about Dorothy Marsh in Bay 7 with her grandchildren's photograph taped to the bed rail, and whether anyone had restarted that heparin drip. Dorothy Marsh, she said. Bay 7. She was here before all this. Where is she? Ostroff didn't miss a beat. We can find out. I need to know she's okay. Mara. Ostroff waited until she looked up. She's okay. I asked Tomas when we arrived. Her heparin rate was corrected at 8:15. The pharmacist flagged it, the attending reviewed it. It's been corrected, she paused. Because of what you did this morning. Before any of this. Mara looked at the table for a moment. Okay, she said. Okay. I'll be part of whatever comes next, but I need to finish my shift first. Ostroff looked at her. You were terminated this morning. I know, Mara said, but the patients don't. She stood up, picked up the granola bar, and walked back out into the corridor. At 2:47 in the afternoon, Tomas found her between bays and his face was the color of someone who has received news that has not yet finished arriving. Calloway's back, he said. She stopped. What? He came back. About 20 minutes ago. He's been in the administrator's office with Wentz. Thomas's voice had dropped to almost nothing. Mara, I heard... Someone told me he's filing a formal complaint. Against you. For practicing outside your scope during the emergency. She processed this. She thought about Paul Wentz in his Saturday suit. She thought about badge logs and incident reports and whoever got to write the first draft of what happened today. "Is Bev's documentation submitted?" she said. She submitted it at 11:30. "Is mine in?" "I filed it as part of the MCI log. Everything's time-stamped." He hesitated. "But Mara, if Calloway's got the board on his side, then the board's going to have a decision to make." She looked toward the administrator's office, down the hallway, the closed door. "Where is Colonel Ostroff?" Tomas blinked. "The woman? She's in the trauma bay, I think." "Get her." Mara started walking toward the administrator's office. "And Tomas, get Priya. Tell her to bring every chart she signed today. Everyone." He went. She kept walking. The door to Wentz's office was closed but not locked. She could hear voices through it. Two men, a particular register of conversation that was not a debate but a strategy session, the sound of people deciding on a narrative. She stopped outside the door and stood in the hallway for a moment, and she was aware of how she looked. Scrubs with someone else's blood on them, hair pulled back in a band that had given up 2 hours ago, no badge because the badge was still on the locker room bench. She thought about what Ostroff had said. "The people who treated you like you were nothing this morning have to do that while everyone is watching." She knocked. There was a pause. Then Wentz's voice. "We're in a meeting." "I know," she said. "Open the door." Another pause. Longer. The handle turned. Seth Calloway was standing in the middle of the office in clean clothes. He'd changed before he came back, she noticed, the detail landing with the particular weight of someone calculating appearances. He looked at her the way he'd looked at her that morning in the corridor, the same architecture of contempt, the same certainty that she was a problem he could manage. "Ms. Ellison," Wentz began, "this isn't the—" "I know about the complaint," she said. "I want to have this conversation now, while the MCI documentation is fresh and while Colonel Ostroff is still in the building." She looked at Calloway. "Unless you'd prefer to wait until the families of the patients you left behind start talking to the press." Calloway's expression didn't change exactly, but something behind it did. "I had a family," he started. "Your badge shows you left at 7:52, she said. "The code orange went out at 7:41, 11 minutes. And your ex-wife was texting Bev Lorca at 10 this morning, asking if the hospital was okay because she hadn't heard from you." The room went very still. From down the hallway, she could hear footsteps approaching. More than one person, the particular rhythm of people moving together with purpose. Ostroff, Priya, maybe Tomas. Calloway looked at her, and for the first time all day, for the first time, she suspected, in longer than that, he was doing the math on a situation where he did not control the variables. His phone buzzed in his pocket. He looked at the screen. Whatever he read there made his face go the color of old concrete. He looked up at Mara. He opened his mouth. "Don't," she said quietly. "Whatever you're about to say, don't." The footsteps stopped outside the open door. Calloway looked at his phone again, then at her, then at the doorway behind her where Ostroff had appeared, and the tablet in Ostroff's hand was facing out now, and on its screen was a document that was not the commendation. It was something else, something with a government seal and a set of signatures, and Mara had not seen it before and didn't know yet what it said. But from the way Calloway's hand was shaking around his phone, she thought he did. The document on Ostroff's tablet was 11 pages long, and Seth Calloway had apparently seen at least part of it before today, because the color that left his face was not the color of someone encountering a surprise. It was the color of someone watching a thing they thought was buried walk back into the room under its own power. Mara didn't look at the tablet. She kept her eyes on Calloway. "Sit down, Seth," Wentz said, and his voice had changed. The pre-screened legal-adjacent affect was gone, replaced by something more careful and more genuinely worried. He'd looked at the tablet, too. Calloway didn't sit. He stood in the middle of the office, and his thumb was moving over his phone screen in the way people's thumbs move when they're trying to reach someone and the someone isn't answering, and Mara recognized the specific quality of that movement. It was the movement of a man trying to activate a network that had, in the last 60 seconds, gone quiet on him. Ostroff stepped into the office. She didn't rush. She set the tablet on Wentz's desk, face up, and left her hand flat on the edge of it. Mr. Wentz, she said, my name is Colonel Diane Ostroff, retired. I currently hold a federal consulting contract with the Office of Medical Readiness, which is the agency that prepared the document you're looking at. That document is a formal request for cooperation in an administrative review of today's events at this facility, filed 2 hours ago and already acknowledged by your hospital system's regional legal office in Denver. She said this without inflection, the way you read coordinates. The review will examine staffing decisions, physician conduct during the mass casualty event, and any retaliatory actions taken against clinical staff in the period before or after the event. Wentz looked at the tablet. He looked at Calloway. He looked at the tablet again. I wasn't informed, he started. Your Denver office was informed at 12:42. I have the acknowledgement timestamp. Ostroff looked at him with the patience of someone who has done this before and is not in a hurry because the outcome is not in question. If you'd like to call them now, the office is still open. The silence in the room had weight and texture. Outside the office door, Mara was aware of Priya standing in the hallway with a stack of charts and the particular stillness of someone listening very carefully. Tomas was somewhere behind her. She could hear the ER behind all of them, reduced but still active, still containing the 17 people who were alive in ways that had required this specific morning to happen. Calloway put his phone in his pocket. He looked at Mara with an expression she hadn't seen on him before. Not contempt, not calculation. Something rawer than either of those things. You did this, he said. You left, she said. I didn't do anything. He opened his mouth again, and Ostroff said, without raising her voice at all, Dr. Calloway, I'd strongly recommend you stop talking and call your attorney. He stopped talking. For a long moment he stood there, and then something in his posture changed, a subtle collapse, not visible in any single part of him, but distributed across all of it, the way a structure gives when the load-bearing element fails. He picked up his jacket from the back of the chair, and he walked out of the office without looking at anyone, and his footsteps down the corridor were the footsteps of someone who had just understood the shape of what was coming. Wentz sat down behind his desk. He looked 10 years older than he had that morning. The complaint he filed, Mara said, against me. It will be withdrawn, Wentz said. He set it to the desk. I need that in writing before I leave this building. He looked up at her. She looked back at him, and she was aware of how she looked. The blood on her sleeve, the borrowed pen clipped to her collar because she'd given her own away to a patient who needed to sign something 3 hours ago. The steady quality of someone who is not performing calm, but actually has it, which is a different thing and reads differently. I'll have it drafted in the hour, he said. She nodded and walked out. The hallway outside felt larger than it had that morning, which was an illusion created by exhaustion and the sudden reduction of acute crisis. Priya was waiting with the charts, and she had the look of someone who had heard everything and was reorganizing what she knew about the world. Is it over? Priya asked. This part, Mara said. What's the next part? Mara took one of the charts from the stack. Terrence Adler's, the inhalation injury from the second wave. She checked the last vitals. He was on the ventilator and holding. His wife had been in the waiting room for 2 hours. Someone needed to go talk to her. The next part is that I need to go talk to a family, she said, and then I need to check on Kieran. Priya fell into step beside her, still holding the rest of the charts. What about Calloway? What actually happens to him? Mara thought about how to answer that in a way that was honest and not unkind, because Priya was 27 and still believed that institutional consequences were swift and proportional, and that belief was going to take more hits before it hardened into something useful. The review process takes time, she said. It won't feel like justice at first. It'll feel like bureaucracy. And then one day you'll get a notification that a decision has been made and the right answer will be in it, and it will feel anticlimactic because by then you'll have moved on to something else. She pushed through the door toward the waiting room. The goal isn't the feeling. The goal is the outcome. Priya was quiet for a moment. Did anyone teach you that? Or did you just figure it out? Someone taught me, Mara said, the hard way. But Terrence Adler's wife was named Gloria, and she was 53, and she had been sitting in the waiting room for 2 hours and 20 minutes with her coat still on, which was the detail that got to Mara, The coat still buttoned like she was ready to leave the moment someone told her she could. Mara sat across from her and told her where Terrence was and what his condition was, and what the ventilator was doing, and what the next 24 hours would look like. She told her the truth, which included the part where the next 24 hours would not be comfortable to watch, because the airway swelling would take time to reduce, and Terrence would be sedated until it did. She told her the realistic version, not the reassuring one, because Gloria had the kind of face that would recognize a reassuring version for what it was and would not trust anything that came after it. Gloria listened. She asked 3 questions, all practical, all good ones. She did not cry, but her hands were doing something complicated in her lap that was the physical equivalent of crying without the release. "He's going to be angry," Gloria said when Mara finished, "when he wakes up, about the machines." "Most patients are," Mara said. He has a thing about control, about needing to be the one." She stopped. "I don't know why I'm telling you that." "You can tell me anything," Mara said. "I'm not going anywhere for a while." Gloria looked at her for a moment. "Are you the one who kept them alive today?" Mara considered how to answer that. "A lot of people kept them alive today. I was one of them." "The firefighter who brought Terrence in," Gloria said. "He told me that when they got there, the hospital was... He said it was like watching someone hold a building up with their hands. He meant one person. He was talking about one person." Mara didn't answer. "You don't have to be modest," Gloria said. "I'm not going to tell anyone anything you don't want told." "I know," Mara said. "But today wasn't about me. It was about the fact that your husband had people around him who didn't stop. That's what brought him through." She stood. "I'll take you to see him now if you're ready." Gloria stood and finally unbuttoned her coat, and the small movement of it, the deliberate unbuttoning, the acceptance of being somewhere for a while, was more than Mara could hold without looking away for a second. She looked away. Then she led Gloria through the door. Kieran was in the step-down unit by mid-afternoon. He was not fully conscious. He was in the shallow, confused half-wakefulness of someone whose brain was recovering from the pressure of herniation and the pharmacology of sedation. But his pupils were equal and reactive, and his left hand moved when Mara pressed her fingers to his palm. His parents were on either side of the bed, his mother with both hands wrapped around his right hand, his father standing very straight in the way fathers stand when they are not ready to fall apart in front of anyone. The neurosurgeon, Dr. Yuen, had returned from Billings an hour ago and had reviewed the procedure Mara performed. She'd come to find Mara in the corridor and the conversation had been brief. "I've reviewed the imaging and the procedure notes," Yuen said. She was 40, direct, with the habit of looking at the person she was talking to and not at anything else. "You had the right read and the right execution under the circumstances." I had guidance," Mara said. "I know. You called Dr. Marcus Teal." "A beat. He trained me." Mara looked at her. "He mentioned it," Yuen said. "When I called him about the case, he said you had the best spatial recall of anyone he'd worked with." She paused. "He also said you left a career that could have gone somewhere because you needed to disappear for a while." She wasn't asking. "He seemed glad you were still sharp." "Tell him I said the same about him." Yuen nodded once and walked away, and that was the whole conversation, and Mara went to check on Kieran. Now she stood in the doorway of his room and looked at his face. 16 years old, the scratch across his forehead where flying debris had caught him, the bruising starting to bloom along his jaw. And she ran the arithmetic of this morning one more time, the version where different decisions were made, where she'd stayed in the parking lot and driven home, where there was no one to take the page from Priya and no one to call the number that wasn't labeled in her contacts. She ran that version and then she stopped running it because it was not useful. Kieran's father saw her in the doorway. He was a refinery worker himself. She'd learned this from the chart, off shift today, which was the specific cruelty of chance that had put his son in the building instead. He looked at her the way people look at someone when they don't know what to do with their gratitude and are a little afraid of it. "They told me," he said, "what you did." "The team did what needed to be done," she said. He shook his head, not arguing, just refusing. "No." He looked at his son's hand in his wife's hands. "Whatever you want to say about teams, I know what they told me, And I know my son is here. He stopped. His throat worked. So whatever the rest of it is, thank you. She nodded. She didn't have a version of "you're welcome" that fit, so she didn't say it. She walked back into the corridor. Whoa. At 4:15, Ostroff found her in the stairwell between the first and second floors. Not the break room, not the corridor, the stairwell, which was where Mara had been standing for approximately 4 minutes, doing nothing except listening to the building around her and letting her nervous system run down from the pitch it had been holding since 6:47 in the morning. Ostroff came down the stairs from the second floor and stopped on the landing and sat on the top step without comment, which meant she'd either been looking for Mara specifically or had developed an accurate read on where Mara would be when she needed to stop. Probably both. The Federal Review request has been formally logged, Ostroff said. Calloway is suspended pending investigation. Wentz has drafted the withdrawal of the complaint. I've read it. It's adequate. Mara leaned against the wall. What does the document say? The one on your tablet. The second one. Ostroff was quiet for a moment. It's a formal declassification request for your service record. Specifically the 2 deployments in the northeastern sector and the Rourke Valley extraction. Mara went still. Rourke Valley was not a name she'd heard spoken aloud in 3 years. It was a name that lived in a part of her memory that she kept separate from everything else, the way you keep a wound separate from the rest of your body. Not ignored, just not touched. Why now? She said. Because of today. Because what you did here today is documented, witnessed, and impossible to quietly file away. Because the families of 17 people are going to talk to reporters, and the reporters are going to want to know who ran the trauma response when the trauma attending was gone, and when they find out it was a nurse who was fired that morning. And they will find out. The story doesn't stop there. It goes back. She paused. We'd rather it go back correctly than incorrectly. Correctly meaning what? What gets released? The commendations, the field citations, the extraction record. Ostroff's voice was level. Not the operational details, not the location specifics, but enough that the public record shows what you were, what you are. Mara was quiet for a long time. The stairwell had the particular acoustic quality of contained spaces. Every small sound was present and distinct. Somewhere above them, a door opened and closed. There are people in those records, she finally said. People who are still in service. If the wrong context gets pulled, nothing that identifies anyone else gets released. You have my word, and more importantly, you have the office's formal commitment in writing. Ostroff looked at her directly. Mara, I know what Rourke Valley cost you. I know why you left. I'm not asking you to go back to any of that. I'm asking you to let the record show what it shows. Mara pushed off the wall. She put her hands in her pockets, which was a habit she'd developed to keep them still when she needed to think and didn't want anyone reading the thinking in her hands. I need to see the full declassification parameters before I agree to anything, she said. I have them with me. I'll read them tonight, not here. Understood. Mara started up the stairs. She stopped on the step above Ostroff's landing. The Rourke Valley extraction, she said. The official record. Does it say why I made the call I made, the full reason? Ostroff looked up at her. It says you made the call under conditions of incomplete information, significant personal risk, and in direct contravention of the advised course of action, and that the outcome, 4 recovered personnel versus the projected 0, justified the deviation. That's the official version. Yes. The real version is that I didn't have time to think about the advised course of action because the advised course of action would have been completed in a room that was already on fire. She said it without emotion, reporting a sequence. I wasn't brave, I was just faster than the alternative. Ostroff was quiet. I want that in the record too, Mara said. The part where it wasn't heroism, the part where it was just the math. I'll make sure of it. Mara went up the stairs. She had one more patient to check on before the end of what had stopped feeling like a shift a long time ago and was now just the day itself, the whole impossible weight of it, and she was almost to the second floor door when her phone buzzed. It was a number she didn't recognize. Montana area code, but not one she knew. She answered it because she'd been answering unknown numbers all day, and they had all been things that mattered. Is this Mara Ellison? The voice on the other end was male, mid-30s, the clipped cadence of someone who spent a lot of time on deadline. I'm calling from the Forsyth Courier. We're running a piece on the Caldwell response. I've been told, by multiple sources, that you were the primary clinical decision maker in the ER today during the mass casualty event. She stood with her hand on the stairwell door. I've also been told, the voice continued, that you were terminated this morning before the explosion by the physician who subsequently left the building when the code orange went out. A pause. I have the badge log timestamps. I have 3 nurses willing to go on record. I have a family whose son you operated on, their words, who has asked me to tell whatever story tells the truth. Another pause. I'd like to hear your side. She stood there. Through the small window in the stairwell door, she could see the second-floor corridor, the nurses' station, Priya at the terminal writing notes, the ordinary machinery of a hospital that had held when it should have broken. How did you get this number? She said. Tomas Reyes, he said. He said you'd probably want to know. She closed her eyes for exactly 2 seconds. Then, from somewhere down the second-floor corridor, the direction of the step-down unit, she heard a monitor alarm fire, sharp and sustained, the specific pattern of a rhythm change, and then she heard running, and she heard Priya's voice call for the crash cart, and she pushed through the door and started running too. She hit the door running, and the phone was already in her pocket because there was no version of this where the phone mattered more than what was on the other side of that door. The crash cart was already in the corridor outside room 214. Priya was at the doorway barking orders at the floor nurse, a woman named Sandra, who had been pulled from the surgical unit 4 hours ago and had been running on competence and stress hormones since. The monitor in the room was still alarming, a rhythm that Mara identified from 6 feet away as ventricular tachycardia, not the lethal kind yet, but moving in that direction with the specific momentum of a problem that had been quiet and was now not. The patient in 214 was not Kieran. It was Dale Ostrowski, the first patient from the refinery. The burn patient, 44 years old, forearm and facial burns, the one whose IV line had looked positional when he came in. He'd been moved to step down 2 hours ago when his pressure stabilized and his fluid balance evened out, and something had changed in the last 15 minutes that nobody had caught on the monitor check because the step-down unit was running on minimum staff. Mara pushed past Priya into the room. Dale was conscious, which was both good and immediately complicating because a conscious patient in VTAC was an alert patient, and alert patients pulled at their leads and asked questions and did not hold still. Dale, look at me. Don't touch the leads. What's wrong with my heart? He said. His voice was hoarse from the smoke, the words coming out slightly wrecked. The machine started screaming. Your heart is in an abnormal rhythm. It's going to correct, but I need you to stay still. She looked at the monitor. Rate was 162, rhythm unstable at the edges. She looked at the IV site on his left arm, the second line that Marcus had placed in the initial resuscitation. The dressing was wet. She pressed along the vein. Dale winced. Infiltrated. The line had tissued, which meant whatever had been running through it in the last 2 hours had been going into the tissue instead of the vein, which meant his electrolyte replacement had not been going where the chart said it was going. Potassium. If his potassium had dropped while the infiltrated line was quietly not delivering what it was supposed to deliver, you got exactly this, a rhythm that started complaining and would eventually stop complaining only because it had moved on to something worse. Get me a stat potassium level, she said to Sandra. Pull it from the right AC, not that arm, and I need a 12 lead now. Sandra moved. Priya appeared at her shoulder. Is this the infiltrated? Yes. How long has that dressing been wet? Sandra, how long? I don't know, Sandra said, already at the blood draw cart. I didn't place this line, and it wasn't flagged in handoff. Mara didn't say what she was thinking about handoffs and minimum staffing and a step-down unit absorbing overflow from a mass casualty event with a skeleton crew. She thought it clearly and thoroughly, and then she set it aside because it was not useful in the next 4 minutes. Dale, I need another IV. Your left arm line isn't working. What does that mean? It means the medication wasn't going where we needed it to go. I'm going to fix it. She took the tourniquet from Sandra's hand. This is going to be quick and it's going to hurt. Tell me you understand." "I understand," he said. He was looking at her the way patients look at someone when they've decided to trust them and are asking the person not to make that decision feel wrong. She placed the line in 40 seconds. Not her cleanest stick. His veins were dehydrated from the burns and the inadequate replacement, but it held, blood flash in the chamber, line secured. "Get me magnesium sulfate and a potassium writer," she said. 2 grams mag over 15. We'll dose the potassium when we have the level." She looked at Priya. "Stand here and watch that rhythm. If it deteriorates, wider complexes, rate over 180, you call a code and you start compressions. You don't wait." "Where are you going?" 30 feet, the nurse's station. I need to see his full med record from the last 4 hours. She was at the nurse's station in less than a minute, pulling Dale's chart on the terminal, running back through every line entry, every fluid notation, every vital sign, constructing the picture of what the step-down unit had actually seen versus what the chart reflected. The gap was not enormous. This was not negligence in the dramatic sense. It was the quieter version, the version born from too many patients and not enough people, and the particular cruelty of a Saturday afternoon when the supplementary staff had thinned and the handoffs had been rushed. The potassium level came back in 11 minutes. It was 2.9, low. Not catastrophically low, but low enough to explain the rhythm, and low enough that if it had kept drifting for another hour with the bad line still in place, they would have been having a very different conversation. She ordered the replacement protocol, watched the first bag go up, watched the monitor while she stood in the doorway of 214. Priya was inside, 12 lead printed, standing at the bedside with the specific alert stillness of a resident who has learned today that standing still and watching can be the most important thing you do. At minute 22, the rhythm converted. Sinus, rate 94. Normal. Dale exhaled. It was the exhale of someone who had been holding something very heavy without knowing it. "Better?" Mara asked. "Yeah," he said. Yeah. She updated the chart. She wrote the incident note with the specificity she'd been preaching all day. Timestamps, findings, interventions, clinical reasoning. She noted the infiltrated line, the missed handoff, the gap in step-down monitoring. She wrote it as a systems failure, not a personal one, because that was what it was, and because the way you wrote an incident note determined what kind of lesson got learned from it. Then she stood up from the terminal, and the adrenaline from the last 30 minutes finished running out, and she became aware, all at once, of how tired she was. Not the shallow tiredness of a long shift. The deep kind. The kind that lived in the body's structural materials. She sat in the chair at the nurse's station for 60 seconds. She counted them. Then she stood up and went back to work. The reporter called back at 5:40. She let it go to voicemail. She listened to the voicemail in the stairwell. He'd left his name, his number, his editor's name, a summary of what he had so far. He said again that he had the badge logs. He said he had a statement from a pharmacist named Revere at Denton General, who had reviewed the heparin order correction from that morning and was willing to describe the clinical implications of what would have happened if it hadn't been caught. He said he had 4 nurses willing to go on the record about a pattern of behavior from Dr. Calloway that extended well past this morning. She stood in the stairwell and listened to the whole message. Then she called Ostroff. "There's a reporter from the Forsyth Courier," she said when Ostroff picked up. "He has the badge logs." "I know. He called the regional legal office an hour ago." "What's the posture?" The office declined to comment, which is standard. But the badge logs are an institutional document. If he has them through a source inside the hospital, that's a hospital matter, not a federal one. A pause. "Mara, the story is going to run. The question is whether you're in it as a subject or as a voice." She thought about that. She thought about the difference between those two things and what each of them cost. "If I talk to him," she said, "it has to be after I've read the declassification parameters. I'm not talking about today in a way that opens questions I can't answer yet. Read them tonight. I'll have them at your door by 7. I don't have a door right now. Calloway had me fired this morning. A beat, then dry as gravel. Then I'll have them at Tomas Reyes's door. He told me you could probably stay with him and his wife tonight if you needed to. Mara closed her eyes briefly. He's been a very busy person today. He has. Something in Ostrov's voice shifted. Not warmth exactly, but the recognition of it. He also called the desk sergeant at the Forsyth PD this afternoon and told them the hospital's badge system had a documented record of Dr. Calloway's departure time and asked whether it was relevant to any inquiry. Apparently, the PD was already fielding calls from the refinery safety board about the adequacy of medical response. She paused. Things are moving, Mara. Faster than I expected. She leaned against the wall. Through the narrow stairwell window, she could see the parking lot, still more full than a Saturday afternoon should be. Family members, some media vehicles at the edge of the lot near the street. The 3 black SUVs still parked in the formation they'd arrived in this morning. Dorothy Marsh, she said. Still stable. I checked an hour ago. Okay. She stood up straight. I'll read the documents tonight. Bob. She found Priya at 7 o'clock sitting in the break room eating vending machine crackers with the mechanical efficiency of someone who had not eaten since morning and had stopped tasting food sometime around noon. She'd traded her white coat for a sweatshirt from her locker, and she had the slightly unfocused look of a person whose body was present but whose mind was still moving through the day. Mara sat across from her. You should go home, Mara said. I'm waiting for Dale's 8 o'clock potassium level. I'll wait for it. Priya looked at her. You were fired. Wentz withdrew the complaint at 5:30. In writing. She'd read it in his office, adequate as Ostrov had said, meaning it said what it needed to say without elaborating on what had prompted it. The employment status is still officially unresolved, but the complaint is withdrawn and the conduct question is closed. Unresolved meaning nobody has reinstated me, and nobody has confirmed the termination through proper process because Calloway left before completing the HR paperwork. She said it flatly, not with satisfaction, just reporting the absurd administrative residue of a day where the normal machinery had failed to keep up with events. I'm in a gray area. Priya was quiet for a moment. She ate another cracker. I want to say something, she said, and I don't want it to sound like I'm not trying to make this about me. Say it. I've been a doctor for 14 months. Before today, I thought I understood what good clinical judgment looked like. I'd seen attendings work. I'd done my rotations. I thought I had a baseline. She stopped. Today moved the baseline, significantly. She looked at the cracker in her hand. I'm not sure how to go back to what normal looked like before today. The cases, the way you moved through them, the way you talked to the families. She put the cracker down. I want to be that. Eventually. I want to be whatever that is. Mara looked at her for a moment. You intubated Terrence Adler with a hot airway and partial obstruction, and you told me clearly what you saw when the cords were obscured, and you adjusted your angle based on one instruction, she said. That's not nothing. That's a 14-month physician doing something that gets people hurt when they do it wrong. She paused. The rest of it, the way you move through it, that takes time. And it takes being in rooms that are hard enough to teach you something. Did today count? Today counted, Mara said. Many times over. Priya picked up the cracker again. She almost smiled. The crackers are terrible, by the way. I don't recommend them. Noted. Nut. Dale Ostrovsky's 8 o'clock potassium was 3.4. Trending up, replacement working, rhythm stable. Mara updated the chart, noted the trajectory, and handed it to the night nurse with specific verbal instructions about the midnight recheck. Then she collected her bag from the locker where she'd left it that morning, walked past the bench where she'd left her badge, and picked the badge up. She stood there for a second holding it. The photograph looked up at her, slightly squinting, slightly washed out, 3 years old. She put it in her bag. Not on her lanyard, just in her bag. She drove to Tomas's house, which was 7 minutes from the hospital, and his wife, Elena, had made soup without being asked, which was either intuition or the result of living with a charge nurse long enough to recognize the specific energy of a person coming off a mass casualty shift. The documents from Ostrov were in a sealed envelope on the kitchen table. Mara ate the soup, and then she opened the envelope and she read for 2 hours while Tomas and Elena moved quietly through the rest of the house. Not asking, just present. The declassification parameters were what Ostroff had said they would be. The operational details were protected. What would be released was the citation record, the field commendations, the summary assessment written by her commanding officer, and the formal recognition of the Rourke Valley outcome. Her name, her rank at discharge, her service dates, the list of specialized training qualifications. It was, on paper, the answer to every question that had been asked about her today and had gone unanswered. She sat at the kitchen table at 10:15 at night, and she thought about the version of her life where she'd stayed in the parking lot that morning, where she'd driven away from the smoke and let someone else handle it. She had thought about that version before, in the abstract, in the philosophical way, the version where self-preservation was the primary value. She understood now, sitting with the soup bowl empty and the document spread in front of her, why she hadn't been able to do it, not because of duty, not because of training, not because of anything that could be made into a speech. Because Kieran was 16 and the math only worked if she was in the room. That was all. It was that simple and that unsentimental. She signed the consent form for the declassification and put it back in the envelope and went to sleep on Tomas and Elena's couch, with the particular completeness of someone who has run all the way to the end of the day and found the ground still there. The Forsyth Courier ran the story on Sunday morning. She read it on her phone at 6:42, sitting on the edge of the couch, the house still quiet around her. The headline was not what she would have written, which was true of most headlines written by someone else about things that happened to you. It said, ER nurse fired hours before disaster. Led the response that saved 17 lives. Where was the doctor? The story was thorough. It was also, she had to acknowledge, fair. The reporter had done the work, had the badge timestamps, had the nurses on record, had a statement from Dale Ostrowski's wife, who had spoken to someone from the Courier the previous evening. It named Calloway. It named the time he left. It quoted Bev Lorca directly. The badge log is a factual record. It shows what it shows. It did not have her comment because she had not given one. It noted this. It also noted in the final 3 paragraphs that sources within the hospital had indicated Mara Ellison had a background that went beyond her nursing role at Denton General, and that a formal record clarification from a federal agency was expected within the next 48 hours. By 7:15, the Courier's website had more traffic than it had seen in its 12-year history. By 8 o'clock, the story had been picked up by the Montana State Wire. By 9, a television crew from Billings was in the Denton General parking lot. Tomas texted her at 8:47. Wentz is here on a Sunday. Calloway's attorney called the hospital twice. You might want to be somewhere that isn't here for a few hours. She texted back. Is the hospital okay? Running. Priya's covering. Dale is stable. Kieran said his first actual sentence this morning. She sat with that for a moment. What did he say? I'm hungry, his mom cried. She set the phone on the couch cushion and let herself have 20 seconds of something that felt like relief but fuller than that, rounded out with all the edges filled in. Then she got up and asked Elena if she could borrow a clean shirt. She met with the reporter, whose name was Daniel Ferris, at a diner on the west side of Forsyth at 11 in the morning. He was 34, with the slightly too alert quality of someone running on coffee and the knowledge that a story he'd been chasing had arrived fully assembled. He had a notebook and a recorder, and he set the recorder on the table and asked if that was all right. It's all right, she said. She told him what she could. She told him about the morning, the heparin order, the confrontation with Calloway, the badge she'd left on the bench. She told him about coming back when she heard the explosion, about the patients, about making the call on Kieran with Marcus Teal on the phone. She told him about Calloway returning and the complaint and Ostroff's documents. She did not tell him about Rourke Valley. She said there was a service record that would be made public through proper channels and that he would have access to it when it was. He asked good questions. He asked some that she didn't answer, and he accepted the non-answers without pushing, which told her he was either genuinely professional or knew he already had enough. When Calloway called you a liability, he said, in front of the staff, what did that feel like? She looked at her coffee. It felt like something I'd survived worse than. He wrote that down. He looked up. And now? What does this morning feel like? She thought about it genuinely, because he'd asked genuinely, and she'd committed to doing this honestly or not at all. Complicated, she said. The outcomes are good. The process was bad, and the consequences of the bad process almost killed people that the good outcome pulled back. Those aren't separate things. The story isn't just that it worked out. The story is also that it almost didn't. He looked at her for a moment. That's not how most people tell a story about themselves. I'm not telling a story about myself, she said. I'm telling you what happened. By Monday morning, 3 things had occurred in the order they occurred, each one landing on the previous like weight on a structure already near its limit. The first was that the Forsyth PD, acting on the inquiry Tomas had set in motion Saturday afternoon and now accelerated by the public attention, formally requested the hospital's full badge log and incident documentation for the period of the Code Orange. It was not yet a criminal investigation. Nobody had used that word. But the request was official and time-stamped, and it meant the records were now in a legal chain of custody that made them very difficult to quietly amend. The second was that the Montana State Medical Board received, between Saturday evening and Monday morning, a total of 11 formal complaints against Seth Calloway, not about Saturday, but about prior incidents. Nurses who had documented concerns internally and been told to drop it. A resident who had submitted a formal grievance 18 months ago that had been reviewed and closed by a process that, on re-examination, appeared to have involved a board member with a personal connection to Calloway's family. A physician from the previous hospital where Calloway had worked before Denton General, who had tried to raise a pattern of conduct 6 years ago and been told the matter was resolved. None of these complaints had resulted in action. All of them were now, as of Monday, being re-examined. The third thing was the press conference. It happened at 2 in the afternoon on the steps outside Denton General's main entrance, and it had not been planned by the hospital. It had been called by Colonel Ostroff, on behalf of the Office of Medical Readiness, with 48 hours' notice to the relevant parties and 0 notice to Calloway's attorney. Mara stood to Ostroff's left. She wore her own clothes, not scrubs. She had decided not to wear the badge. She was not sure yet whether it meant she'd moved past it or just hadn't decided what to do with it. Ostroff read from a prepared statement. She described the Federal Review's preliminary findings. She described the declassification of Mara's service record in broad and factual terms. The service dates, the qualifications, the field citations, the commendation for the Rourke Valley extraction, the formal recognition that had been classified and was now public. She named the specialized medical training. She named the combat deployment record. She named the assessment written by Mara's commanding officer at discharge, which said, among other things, that Mara Ellison possessed the kind of clinical judgment under pressure that training could refine but not create. She did not make it a speech. She made it a record. Cameras ran the whole time. The reporter from the Courier was in the front row. There were television crews from 3 stations now, including one from Denver that had driven up overnight. When Ostroff finished, she opened it to questions. The first question was about Calloway. Ostroff referred it to the hospital. The second question was directed at Mara. What did she want people to take from this? She looked at the cameras, and she thought about the honest answer versus the polished answer, and she'd already decided in the diner with Daniel Ferris that she was only interested in the honest one. I want people to understand that what happened on Saturday wasn't exceptional, she said. It was the result of a system that had been underfunded, understaffed, and protected from accountability for a long time. 17 people are alive not because of a miracle, but because there were enough people in that building who refused to stop doing the work in front of them. That's the lesson, not me. The work. A follow-up came immediately. What about Dr. Calloway's claim that you acted outside your scope of practice? The complaint was withdrawn, she said, in writing, before the story ran. And his departure during the Code Orange? That's a matter for the review, she said. The badge logs are in evidence. Everyone can read them. Mike. Calloway did not attend the press conference. He had, according to his attorney's statement released that morning, requested a voluntary leave of absence from Denton General pending the resolution of the review. The statement said he was committed to cooperating fully with the inquiry. The hospital board met in emergency session that same afternoon. Mara was not in the room. She knew what was happening because Bev texted her updates from outside the boardroom door, where Bev had positioned herself with the specific purposefulness of someone who had been working in this institution for 14 years and was not going to be kept uninformed about decisions that affected it. 4:17 p.m. They're reviewing the badge logs. 4:34 p.m. Pofer p.m. Someone brought up the prior complaints. Plural. 4:51 p.m. Callaway's board connection, Hargrove, has recused himself. That happened fast. 5:08 p.m. They're going to vote. At 5:22, Bev sent a final text. It was not a summary. It was a single sentence. Suspended indefinitely pending full investigation, immediate referral to state medical board, and the complaint system is being audited going back 5 years. Mara was sitting in Tomas's kitchen when she read it. She read it twice. She set the phone on the table and sat with it for a moment. The specific feeling of an institution doing the right thing after doing the wrong thing for a long time, which was not the same feeling as an institution simply doing the right thing, but was better than the alternative. Thomas came in and looked at her face and said, "Good news?" "Progress," she said. "It's not done." "What's left?" She picked up the phone. She turned it over in her hands. The board suspended him. The state medical board has the complaint referral. The PD has the badge logs. She looked up. But the formal medical review hearing, the one that decides whether his license gets pulled, that's separate. And that one's going to need witnesses. Witnesses like nurses who documented complaints internally and were told to drop it, like the resident from 18 months ago, like the physician from his last hospital. She set the phone down. And like the attending who reviewed my performance on Saturday and can testify about what the clinical record actually shows. "Dr. Yuen," Tomas said. "She already told me she'd speak. So did Priya." A pause. "So did Ostroff." Tomas pulled out a chair and sat down across from her. He looked like he wanted to say something and was choosing between several versions. "Say it," she said. "You know he's going to claim, his attorney is already framing it, that you orchestrated this, that the whole thing was retaliatory." "I know." The timing looks like what it is," she said. "He fired me at 7 in the morning. The explosion happened at 7:41. I went back because there were patients. The timeline is documented, witnessed, and in evidence." She looked at him steadily. "He can claim whatever he wants. The record says what happened." Tomas nodded slowly. He'd been nodding slowly all day in the particular way of someone processing a volume of information that would take time to fully settle. "One more thing," he said. He slid an envelope across the table. It was from the hospital. Denton General letterhead, her name on the front. She picked it up. She opened it. It was 2 pages. The first page was the formal withdrawal of her termination, countersigned by Wentz and by the board chair. The second page was an offer of reinstatement with a formal letter of commendation attached, citing her actions during the mass casualty event. She read both pages. She read them again. "They want you back," Tomas said. "I can see that." "Are you going back?" She set the letter on the table. She looked at it. The offer was real and the commendation was real, and 3 years of her life had been built inside those walls. And the walls had held on Saturday in a way they should not have had to hold. And something about the building felt different now. Not the building itself, but her relationship to it, which had changed in ways she was still measuring. "I don't know yet," she said. Her phone buzzed on the table. Not a text. A call. The number was a Denver area code she didn't recognize. She looked at it. "You should probably answer that," Tomas said. She picked up. "Ms. Ellison?" The voice was professional, measured, with the particular cadence of someone who called a lot of people with news that had weight to it. "My name is Adrienne Voss. I'm the executive director of the Montana Medical Standards Consortium. We've been following the Denton General situation closely, and in light of the declassification of your service record and the events of Saturday, the consortium board would like to formally request your participation in the upcoming review hearing." A pause. "We'd also like to discuss something else. We've been authorized to extend an offer, a formal sponsorship for medical school, in partnership with the Office of Medical Readiness, to candidates with your specific background. There's a pathway being developed for individuals with field medical experience who are—" "Ms. Voss," Mara said, "I appreciate the call. Can I ask how you got this number?" A pause, then, almost amused, "Colonel Ostroff." Mara looked at the table. "Of course." I'll call you back tomorrow, she said. I have one more thing to deal with today. She hung up. She sat for a moment, then she stood, picked up the letter of reinstatement, and put it in her bag next to the badge. She was halfway to the door when Tomas said, "What's the one more thing?" She stopped. She turned back to look at him, and she thought about how to say it in a way that was accurate. Calloway's attorney filed a countermotion this afternoon, she said, against the federal review, claiming procedural irregularity in how Ostrov's team engaged with the hospital. She paused. He also submitted a supplemental claim to the medical board, alleging that the declassification of my record was selectively timed to influence the investigation. She watched Tomas absorb this. He's not wrong about the timing, technically. It was timed. Ostrov chose when to release it. The question is whether the reason for the timing changes what the record says. Does it? No, she said, but it gives his attorney a procedural argument, and procedural arguments can stall things for months. She zipped her bag. Ostrov is responding tonight. I need to be there. What does the countermotion mean for the hearing? She looked at him. It means Calloway isn't done, she said. It means he's got one person left he thinks can help him, and that person is a board member named Hargrove who recused himself this afternoon, but whose recusal, according to Ostrov, may not have been fast enough to keep his prior communications out of the audit. Tomas went still. What kind of prior communications? The kind that suggests the 5-year complaint audit is going to find more than one person's name in it, she said. And then she walked out. Ostrov was in the conference room of the Forsyth extended stay when Mara arrived, which was not a glamorous location for the kind of work happening inside it. The room smelled of old carpet and the particular staleness of spaces rented by the week, and Ostrov had commandeered the folding table and covered it with printed documents, a laptop, and 2 phones. And she was on one of the phones when Mara walked in and she pointed at the chair across from her without interrupting the call. Garrett was at the other end of the table, working through a document with a highlighter, and he looked up when Mara sat down and said, "The counter motion is thin," without preamble. Calloway's attorney is arguing that Ostrov's team constituted an unauthorized external entity operating within hospital jurisdiction. The problem with that argument is that the Office of Medical Readiness has clear statutory authority to conduct welfare reviews at federally accredited facilities, and Denton General is federally accredited. So it fails, Mara said. It fails on the merits. It still has to be formally answered, which takes time, which is what it's designed to do. He set down the highlighter. The Hargrove piece is different. Tell me. Richard Hargrove has been on the Denton General Board for 9 years. His nephew is a second-year surgical resident at a teaching hospital in Denver, got the position through a competitive process that was, on paper, clean. But Hargrove and Calloway have had 17 documented email exchanges over the past 4 years, 11 of which involve personnel matters. Garrett turned the document to face her. 3 of those emails contain direct references to complaint files that should never have reached Hargrove as a board member. They're clinical HR matters, outside his governance scope entirely. He shouldn't have been seeing them, but he was, because Calloway was forwarding them. Mara looked at the emails on the page. She didn't read them in full. She read enough to understand the architecture. Calloway had been feeding Hargrove information, and Hargrove had been using his board position to quietly close loops before they became problems. The resident complaint 18 months ago. A nurse's formal grievance the year before that. A physician who'd raised concerns before Calloway even moved to Denton General. That one had apparently followed him, and Hargrove had made a call to the right person at the right institution, and the concern had been recorded as resolved. Resolved. That word doing so much work, the way it always did when the machinery of protection was running smoothly. How did you get these? She said. The audit, Garrett said. The board authorized a 5-year complaint audit Monday afternoon. When the auditors pulled the file records, they found the correspondence in the HR archive. Calloway CC'd the institutional email address, which means it's hospital property. Ostrov ended her call and set the phone on the table. Hargrove's attorney contacted the board chair at 6 this evening, requesting that the audit be paused pending a legal review of document privilege. She sat down. The board chair declined. Who's the board chair? Mara said. A woman named Patricia Sue. She's been on the board 3 years, she's a retired hospital administrator from Billings, and she has approximately 0 patience for procedural delay when the documents in question involve patients. Ostroff picked up her coffee, looked at it, set it back down. She called me at 5:30 and asked what the Federal Review needed from the board to complete its preliminary report. I told her. She said she'd have it ready by Wednesday. The room was quiet for a moment. Outside, the parking lot of the extended stay was doing what parking lots did at 7 in the evening. Mostly empty, a few cars belonging to people spending their week somewhere that wasn't home. The counter motion, Mara said. When does it get answered? I'm filing the response tonight. The procedural argument collapses on the statutory authority question. It's not a close call, it just requires someone to write the brief. Ostroff looked at her steadily. The hearing is still on track for Thursday. 3 days. What happens Thursday? The medical board convenes. They'll hear from the clinical witnesses. Yuen, Nambiar, the pharmacist, Bev Lorca. The badge log goes into evidence. The 5-year audit findings go into evidence. She paused. And the complaint record from his previous hospital goes into evidence because the physician who raised concerns 6 years ago has agreed to testify by video. Mara thought about that. About a physician who had tried 6 years ago and been told it was resolved, and who had apparently kept the documentation anyway, kept it in some form or another, a file somewhere, a record of what had been said and when, on the chance that one day the resolution would need to be revisited. People keep records, she said, half to herself. The ones who know what documentation is worth do, Ostroff said. Potem. She slept better that night than she expected to. Not well. She woke up twice, once from a dream that wasn't a nightmare, but left her sitting upright with her heart going faster than the content of it warranted, and once because Tomas's house had a radiator that made a sound at 3 in the morning that was very difficult to ignore. But she slept, and when she woke at 6:15, the morning had the clean quality of a day that was going to require her to be present in it. She called Adrienne Voss at 8 o'clock. The conversation was 40 minutes. She asked every question she had, and Voss answered them with the precision of someone who had anticipated the questions and respected the fact that they were being asked. The medical school sponsorship was real, a 2-year partnership between the Office of Medical Readiness and a consortium of medical programs that had been developed specifically to create a pathway for candidates with unconventional but substantial clinical backgrounds. Field medics, flight nurses, combat surgical techs who had done things in operational environments that most physicians wouldn't see in a career, and then returned to civilian life and been funneled into roles that used roughly 30% of what they were capable of. The program isn't charity, Voss said. It's a recognition that the candidate pool for emergency and trauma medicine has an untapped segment that the traditional pathway doesn't reach. You'd still complete the full curriculum. The sponsorship covers costs and provides mentorship, not shortcuts. I'm 34, Mara said. The program's oldest current participant is 41, Voss said. He spent 12 years as a Navy corpsman and 2 as an ER nurse. He's completing his 3rd year of residency in emergency medicine in Tucson. She sat with that for a moment. 41, 3rd year of residency. The math of it, the sheer commitment of time and endurance the math represented, sat in her chest with a particular weight that was not discouragement, but something that required examination. I need to get through Thursday, she said, and then I need to think. That's a reasonable answer, Voss said. The application window doesn't close until the end of the month. Tuesday and Wednesday moved the way days move when you're waiting for a fixed point, unevenly, some hours long and some compressed, the ordinary texture of life insisting on itself in the gaps. She went back to Denton General on Tuesday, not as staff but to see patients. No one stopped her. Wentz's office was closed, and his assistant looked at her with the careful neutrality of someone who had been told not to engage with the situation beyond their clearance level. Kieran was sitting up. She found him in his room in the step-down unit, still connected to monitors but with the tubes gone and the glazed quality of the first days replaced by the tentative alertness of someone whose brain was re-establishing its relationship with the external world. His mother was in the chair beside him, and his father was standing at the window, and the photograph of the family that someone had printed from a phone and taped to the wall above the TV. She suspected his mother, the same impulse as Dorothy Marsh's grandchildren,
was the detail that made the room feel like a room people were living in rather than just occupying. Kieran looked at her when she came in. He was 16 and had a 4-inch bandage on the left side of his head where the surgical site was, and he looked at her with the specific directness of a teenager who had not yet developed the social instinct to soften his gaze. "You're the one," he said. "I'm one of several," she said. "How are you feeling?" "My head feels like someone rearranged it." "That's accurate." He looked at her for another moment. "My dad said you did the surgery." "An emergency procedure. Dr. Yuan completed your care. He said you did it on the phone with someone." "I had guidance."
Kieran seemed to be working through the mechanics of this, the image of it, a person on a phone guiding another person's hands through something that couldn't wait. His face moved through several expressions in quick succession, which was the face of a 16-year-old processing something that didn't fit any frame he already had. "That's kind of insane," he said finally. "It was a difficult morning." He almost smiled. The almost smile of a kid who was going to be all right, which was not the same thing as a kid who was unchanged. He was changed. She could see it in how he held himself. The particular gravity of someone who had been very close to an edge and knew it. But all right, which was the thing that mattered. His father turned from the window. He looked at Mara the same way he'd looked at her before, with the gratitude that made him slightly afraid. And this time she let herself receive it without deflecting. "Thank you," he said. Just that. "Take care of him," she said. And she meant the son, but she also meant him, the father, who was going to carry Saturday for the rest of his life in ways that would be invisible to most people and very loud inside his own chest. He nodded. She could tell he understood both things. She stopped by Dorothy Marsh on her way out. Dorothy was reading a library paperback and had her glasses on and looked up when Mara appeared in the doorway with the alert pleasure of someone who had been waiting, maybe without knowing it, for a specific visitor. "They told me what you did," Dorothy said, "about the drip." "The pharmacist confirmed it," Mara said. "The correction was a team effort. The nurse who confirmed it this morning told me it was you who flagged it first, before the explosion. Before everything." Dorothy put her bookmark in the paperback and set it on the bedside table. "You were already fighting for me before I even knew there was a fight." Mara stood in the doorway and felt something move through her that she didn't try to name. "You're going to be okay," she said. "Your GFR is improving. The attending will talk to you about the transition plan today." "I know." Dorothy looked at her. "Are you going to be okay?" The question landed in a way she hadn't expected. Not because it was surprising, but because it was asked with the particular directness of someone who was genuinely asking, not performing concern. "I think so," Mara said. "Eventually." Dorothy nodded like that was the right answer, which meant she'd lived long enough to know it was. The hearing was Thursday morning at 9 o'clock in a conference room at the Montana Medical Standards Building in Forsyth, which was a low brick building on the north side of the city that had the functional grimness of every regulatory institution that existed to do necessary work nobody wanted to need. The room had long tables arranged in a U-shape, a panel of 7 board members, a court reporter, and a case officer who managed the procedural elements with the patient efficiency of someone who had presided over many of these and found drama neither useful nor interesting. Calloway arrived with 2 attorneys. He sat across the room from the witness area, and he looked different than he had on Saturday. Not diminished exactly, but reduced. The Saturday version of him had occupied space in a particular way, the way people do when they've spent years in rooms where their presence is the dominant variable. This version was wearing the same suit, had the same jaw, the same posture, but something behind all of it had recalibrated. He knew what was in the room today. He'd had 3 days to read the documentation. His lead attorney, a man named Croft, who had the compact manner of someone who charged a great deal per hour and intended to justify it, had filed the procedural objection to Ostroff's involvement again, in writing, the night before. The board chair, Patricia Sue, who was in the center of the panel and who had the particular quality of someone who had spent 30 years in hospital administration and could identify a delaying tactic at 40 paces, had the objection in front of her and had clearly already read it. "We've reviewed the procedural objection," she said before Croft could open his mouth. "The panel finds no basis to exclude the federal review findings. Colonel Ostrov's team operated within statutory authority. We're proceeding. She looked at the case officer. First witness. Croft looked like he wanted to object to the ruling on the objection, which was not how hearings worked, and he absorbed this for a moment and then wrote something on his notepad. Bev Lorca testified first. She was in her Denton General uniform, and she spoke with the methodical clarity of someone who had rehearsed nothing but knew exactly what the facts were and in what order they occurred. The badge log, the timestamps, the code orange notification time, the 11-minute gap. She had printed copies of the log, certified by the hospital's IT administrator, and she placed them on the table with the care of someone delivering something that had been in her safekeeping and was now where it belonged. Croft cross-examined her about whether the badge system had ever malfunctioned. Twice in 14 years, Bev said. Both instances were documented. Neither was on Saturday. Dr. Priya Nambiar testified next. She was in her white coat, and she had the contained quality of someone who was more nervous than she looked, but had made a decision about what kind of physician she intended to be and was living in that decision in real time. She described the morning chronologically. She described what she had seen Mara do, in clinical terms, with the specificity of a physician presenting a case, not advocacy, not narration, just the medical facts of what she had observed and what the outcomes had been. The board asked whether, in her assessment, the interventions were medically appropriate. Every intervention was indicated and executed correctly, given the information available at the time, she said. I've reviewed the outcomes. In each case, the clinical reasoning was sound. Croft asked whether she was qualified to assess the clinical reasoning of a nurse performing procedures outside her licensure. I'm qualified to assess clinical outcomes, Priya said, and to compare them against what I understood the alternatives to be at the time. Which was? In several cases, the alternative was death, she said. Flat, factual, no elaboration. Doctor. Sandra Ewan testified about Kieran. She described the imaging, the procedure, the outcome. She used the words that mattered: indicated, correctly executed, life-saving, appropriate under the circumstances. She said that the decision to proceed rather than wait for transfer demonstrated the correct assessment of time to irreversible injury. She said that, in her professional opinion, the outcome would not have been achievable otherwise. Croft asked whether a nurse should be making that assessment. A nurse with that training record and that specific field experience is better equipped to make that assessment than most of the physicians I trained with, Ewan said. That's not an opinion. That's a reading of her service record. The pharmacist, a woman named Claire Revere, testified about the heparin order. She walked the panel through the clinical pharmacology, renal function, anticoagulation dosing, bleeding risk, with the patience of someone explaining something to adults who were capable of understanding it if you trusted them with the full picture. She said that the original order carried significant risk for the patient. She said that Mara's decision to stop the drip and flag it was clinically appropriate and had likely prevented a serious adverse event. Croft asked whether the correct procedure was to stop the drip or to document and notify. Documenting and notifying is the correct procedure when there's time, she said. When there isn't, stopping the intervention is appropriate. She looked at the panel. The patient had a GFR of 11. There wasn't time. The physician from Callaway's previous hospital testified by video on a screen at the end of the table. His name was Dr. Warren Cale, and he was 62, and he had raised a concern 6 years ago and been told it was resolved, and he had kept every email, every response, every document from that process in a folder on his personal computer for 6 years. He had not known when he saved them that he would use them. He'd saved them the way you save documentation when something feels wrong and you can't prove it yet, and you want to be ready if the day comes. The day had come. He described the incident that had prompted his concern, a staffing situation, a patient outcome, and Callaway's conduct in the aftermath. He described the formal concern he'd raised. He described the response. He described being told by an administrator he later learned had a professional connection to one of Callaway's references, that the matter had been reviewed and found without basis. Did you believe that finding? The board chair asked. No, he said, but I was a junior attending and he was already established. I calculated that I wasn't going to change the outcome by continuing to push, so I documented what I had and I moved on. A pause. I should have pushed harder. That's something I've had to sit with. The room was quiet after that, in a way that had texture. Calloway testified in the early afternoon. He arrived at the witness position with the careful composure of someone who had rehearsed, and he delivered a version of events that was not entirely false, but was shaped in the way that versions of events get shaped when someone has spent 3 days with attorneys working on them. He described the family emergency. He described his state of mind. He described the reasonable steps he took to ensure coverage before he left. The board chair asked him to identify specifically who he had confirmed as covering the trauma response before he departed. He named Dr. Finch. The case officer produced Finch's testimony, submitted in writing, which stated that Calloway had called him but had not confirmed coverage, had instead indicated that he was stepping away briefly and would return, and that Finch had understood this to mean Calloway was moving to another part of the building, not leaving the facility. The board chair read this aloud. Croft objected to this characterization. The board chair noted the objection and asked Calloway again whether he had confirmed coverage. Calloway's composure held, but the version of events had a gap in it now, a gap that had been measured and documented and placed on the table in front of everyone, and there was no attorney in the world who could fill a gap like that with language. The board recessed at 3:15. They returned at 4:40. The board chair read the findings. She read them without performance, which was the right way. The findings didn't need amplification. They were sufficient on their own terms. Abandonment of clinical duty during an active mass casualty event. Pattern of conduct constituting abuse of authority and suppression of staff concerns supported by the 5-year audit findings. Evidence of improper access to personnel complaint files through a board member who had subsequently recused himself under circumstances that were themselves being reviewed. Conduct prejudicial to patient safety and institutional integrity. The license suspension was immediate, pending a full disciplinary review. The referral to the State Attorney General's office regarding the Hargrove correspondence was confirmed, not a certainty of criminal charges, but a referral, which meant someone with different authority was now going to read those 17 emails. The board also issued a formal finding that Mara Ellison's actions during the mass casualty event, while performed under exceptional and unprecedented circumstances, were clinically indicated, appropriately executed, and instrumental in preventing additional patient deaths. The finding recommended that the hospital's credentialing committee review the parameters of advanced nursing scope in emergency contexts in light of documented field medical qualifications. It was not a vindication in the dramatic sense. It was a finding recorded in the official proceedings of a regulatory body, which was the institutional version of the truth being written down and made permanent. Less satisfying in the moment than it would have looked from the outside. More durable than anything that felt good in the moment. Calloway walked out of the room without speaking. His attorneys flanked him and they moved quickly, the movement of people executing an exit that had been planned for. He did not look at Mara. She sat at the witness table and watched him go and felt nothing that she would call satisfaction, because satisfaction implied that the work was over, and the work was not over. Patients would need care tomorrow. Systems needed changing. The resident who had filed a complaint 18 months ago and been dismissed was going to need someone to acknowledge what had been done to her. Satisfaction was a door closing. This was a door opening onto more work, which was the less cinematic version, but the one that was actually true. Ostroff sat down beside her when the room had mostly cleared. Hargrove's attorney filed for a voluntary resignation from the board this afternoon, she said, before the findings were read. He knew what was in them. His attorney did, yes. Ostroff looked at the table in front of them, the cleared documents, the empty chairs of the panel. The Attorney General referral is real. The emails are what they are. Whether that becomes charges depends on a process I don't control. But the audit findings are public record. As of 5 o'clock today, yes. Mara nodded. She thought about what public record meant, not the dramatic version, not headlines and cameras, but the durable version, where the finding existed in an archive and anyone who looked would find it and find it accurate. Where the nurses who had documented concerns and been told to drop it would see those concerns acknowledged in the official record of a regulatory body. Where Dr. Warren Cale's 6-year-old folder of emails had finally arrived at the place they'd been saved for. Documentation, in the end. The thing she'd been saying all day Saturday while everything was on fire. The things she'd learned in environments where what you wrote down was sometimes the only evidence that something had happened at all. She called Adrienne Voss that evening. "I'll apply," she said. "I was hoping you'd say that. I want to be clear about something first. I'm applying because I want to be better equipped to do the work, not because of what happened this week. The week accelerated the decision, but it didn't create it." "Understood," Voss said. "That's actually the answer the program is looking for." She hung up and sat for a while on the steps of the extended stay parking lot where she'd been standing when she made the call, because the room felt too small for the after silence of a decision that size. The evening was cold, in the particular way Montana evenings were cold. Not hostile, just honest about what the temperature actually was. And the sky above the parking lot lights was a deep, clear dark with stars that were visible in ways they never were in cities with more ambient light. She thought about the morning that had started all of this. The badge on the floor. The way Calloway had said "my team" in a tone that excluded her. The way she had walked to the parking lot and almost driven away. She thought about the things she'd said to Daniel Ferris. It felt like something I'd survived worse than. She'd meant it as a deflection at the time, a way of answering without answering. But sitting on the steps now, she understood it was also just true. She had survived worse. She had survived things that didn't have institutional hearings or board findings or formal vindications, things that were just what had happened in places that didn't make the news. And she had carried those things forward into a life that had looked, from the outside, like a step down. It hadn't been a step down. It had been a place to stop and recalibrate, to live inside her own skin for a while without the weight of operational life pressing on every surface. And then a refinery had exploded, and the ground had told her it was time to move again. She went back inside. She picked up her bag. She texted Tomas, "I'm applying to the program. Tell Elena thank you for the soup, both nights." He texted back in under a minute. "She's going to be insufferable about this. She already told me she knew you were going to do something big. Tell her she was right. She knows." 3 weeks later, the Forsyth Courier ran a follow-up piece. Daniel Ferris had done the work. He'd tracked the audit findings, the Hargrove resignation, the Attorney General referral, the medical board's suspension record. He'd interviewed the resident who'd filed the complaint 18 months ago, a woman named Dr. Tessa Park, who had requested to be identified by name because she was done with the particular invisibility of people who raise concerns and get told the matter is resolved. He'd interviewed 2 of the nurses who'd been on record from Saturday. He'd also interviewed Mara. The piece ran on a Sunday morning, longer than the first one, with a photograph taken outside Denton General that she'd agreed to. Not dramatic, she wasn't in scrubs, wasn't posed heroically, was just standing in the parking lot in her regular clothes in the morning light, looking at the camera with the expression of someone who was done looking away. The headline said, "The work doesn't care who gets the credit. The nurse who ran the room and what comes next." She read it at Tomas's kitchen table. She read the whole thing without stopping, which was harder than she expected. Not because it was inaccurate, but because seeing your own story told in someone else's words required the specific tolerance of accepting that you'd been seen. The piece quoted her directly, near the end, from a question Ferris had asked that she'd almost not answered. "What do you want people who were dismissed, overlooked, told they weren't enough? What do you want them to take from this?" She'd sat with the question for a long time before she answered it, long enough that Ferris had wondered if she was going to. Then she'd said, "I want them to keep the documentation. I want them to write down what happened and when and who was there and what was said, and I want them to keep it even when they're told the matter is resolved. Because systems change slowly and people change slowly, and the resolution that looks final usually isn't. The record outlasts the moment. And the record is the thing." She read it again in print. It sounded right. Not inspirational in the speech and music way, but in the way that things sound right when they've been tested against something real. She folded the paper. She picked up her application to the medical school program, which she'd completed the night before and had been sitting in an envelope on the table, addressed and sealed. She put the paper in her bag. She picked up the envelope. She thought briefly about the badge still at the bottom of her bag. The laminated square with the slightly squinting photograph. She still hadn't put it back on her lanyard. She wasn't sure she would. The badge was what someone had given her to wear in an institution that had looked at her and understood roughly a third of what she was. That was not the institution's fault entirely. She had kept the rest of herself private, for reasons that had made sense at the time. She wasn't interested in private anymore. She was interested in the work, in being equipped for the full weight of it, in standing in a room where someone needed something and having every tool available rather than the portion she'd been allotted. 17 people were alive. Kieran was home, recovering, eating, arguing with his mother about things the way 16-year-olds argue about things. Dorothy Marsh had been discharged with a corrected care plan and a follow-up appointment and the paperback she'd been reading. Terrence Adler had been extubated a week ago and was, according to Gloria, already complaining about the hospital food, which Gloria had reported to Mara as the best possible sign. Dale Ostrowski had sent a handwritten note to the hospital, addressed to the nursing staff, to Mara specifically, that had been photocopied and put on the break room bulletin board. It said, "I don't know how to thank you for what you did. I have 4 kids. I'll try to deserve the time you gave back to me." The note was still there when she'd been in last. She'd stood in front of it for a minute. She hadn't taken it down. That felt like the right call. Leave it where people could see it, where it could do the work of reminding everyone in the building why the building existed. She drove to the post office. She mailed the envelope. Then she drove to Denton General. She walked through the ER entrance, past the trauma bay, past Bay 7, where Dorothy had been, past the locker room door. She went to the nurses' station. Bev was there, mid-shift, and looked up when she walked in. "You need something?" Bev said. "No," Mara said, "just checking the board." She looked at the patient board. 12 patients in-house, nothing critical. The ordinary rhythm of an emergency room on a Tuesday morning. Priya was writing notes at the terminal, and she looked up and lifted her chin in acknowledgement and went back to writing. Marcus was pushing a supply cart down the corridor toward Bay 4, and he saw her and said, "Hey," without breaking stride, which was the right greeting for the morning. She stood there for a minute in the space between the station and the trauma bay, the same space where she'd stood 3 weeks ago with everyone watching and Calloway walking away. And the space felt different now, not because anything about it had changed physically, but because everything about her relationship to it had. She had not decided yet whether she was coming back here after the program. That was a decision for a different version of herself, the one who would exist 2 years from now with a different set of tools and a different set of options. That version would look at the board and make the call. This version had an application in the mail and a full day ahead of her and an understanding that she had been standing in rooms that needed her for a long time and that she'd been doing it with her hands tied behind her back and that she was done with that now. She had not been an ordinary nurse. She was not going to be an ordinary anything. She was going to be the most equipped person in the room, and then she was going to do the work. And the work would speak for itself, the way work always does when you stop waiting for someone else to describe it and just do it at the level it requires. She picked up her bag. She walked back out through the ER doors into the Montana morning, which was cold and clear and entirely indifferent to everything that had happened in the building behind her, and that indifference felt like permission to begin, to build, to be exactly as large as the work demanded. She got in her car. She drove toward whatever came next.